بسم الله الرحمن الرحيم. Endometriosis Associated Ovarian Cancer TOG أكتوبر 2024. هنتكلم في الموضوع ده على Introduction, Epidemiology, Pathophysiology, Screening, Risk Reduction Strategies, Treatment Strategies, وآخر حاجة هو البروجنوز. Starting with Introduction, endometriosis is a chronic gynecologic condition characterized by the presence of endometrial-like tissue outside the uterus. With presentation, it presents with pain and infertility as the most common presentation. And it affects about 10% of women of reproductive age. بالنسبة للأوفاريان كانسر، احنا عارفين أوفاريان كانسر ممكن يكون epithelial ovarian cancer, germ cell tumor, or sex chordostromal tumor. The most common is epithelial ovarian cancer, and it forms about 90% of all cases of ovarian cancer. Regarding the relation between endometriosis and ovarian cancer, now endometriosis has been identified as a risk factor for specific subtypes of ovarian cancer, especially endometrioid and clear cell carcinoma. Regarding epidemiology, the lifetime risk of developing ovarian cancer is 2 per 100. الريسك ده بيتضاعف في الحالات اللي عندها endometriosis، يعني بدل ما بيبقى 2% بيبقى 4%. Endometriosis is specifically associated with clear cell carcinoma and endometrioid carcinoma. والريسك بيبقى أعلى في clear cell carcinoma، يعني risk of clear cell carcinoma is tripled, relative risk 3.4. لكن مع الendometrioid carcinoma the risk is doubled, relative risk 2.3. بيتميز الendometriosis associated ovarian cancer, it can be detected earlier than non-endometriosis associated ovarian cancer. رغم ان الريسك بيزيد مع كل انواع الاندوميتريوزس، it is significantly increased with ovarian endometriosis, relative risk 2.4 اكتر من البريتونيال اندوميتريوزس، لان دي ما هياش significant increase، relative risk بيبقى 1.3. لما نتكلم على debulking surgery كمانجمنت of ovarian cancer, the likelihood of achieving optimal debulking surgery is similar between endometriosis associated ovarian cancer and the non-endometriosis associated ovarian cancer. Regarding pathophysiology, current evidence suggests a causal relationship between endometriosis and ovarian cancer. However, the definitive mechanism is still under investigations، لكن في بعض الكي ميكانيزم زي chronic inflammation. معروف ان endometriosis is a state of chronic inflammation, and long-standing inflammation leads to increased production of cytokines and growth factors, which promotes cellular growth and proliferation. كمان endometriosis بيبقى معاه excess estrogen, which promotes cellular proliferation and survival. Oxidative stress. The reactive oxygen species generated within endometriotic cyst leads to oxidative damage of the surrounding tissue and DNA. وفي بعض genetic mutations موجودة في endometriotic tissue which leads to transformation into a malignant tissue. هنقول منها أمثلة زي ARID1A, P10, PIK3CA, KRAS, and TP53. دي genetic mutation موجودة في endometriotic tissue which promotes malignant transformation. Regarding screening, routine screening for ovarian cancer in general is not recommended in the general population. طيب بالنسبة للحالات اللي عندها endometriosis واحنا عارفين ان الريسك دبل من 2% بقى 4%، هل التوصية دي بتختلف؟ بنقول لا. Similarly, screening for ovarian cancer in women with endometriosis is not recommended, as there is no evidence to show its effectiveness. Regarding risk reduction strategies, risk reduction for endometriosis-associated ovarian cancer is similar to other conditions associated with ovarian cancer. على سبيل المثال حالات BRCA1 و BRCA2 Lynch syndrome is associated with increased risk of ovarian cancer. BRCA1 على سبيل المثال بيبقى الريسك 44 in 100، ودي recommended to perform bilateral salpingo-oophorectomy between 35 and 40 years. BRCA2 is associated with 17% risk. بيبقى time of bilateral salpingo-oophorectomy 40 to 45 years. Lynch syndrome مع bilateral salpingo-oophorectomy ممكن نضيف معاها hysterectomy and can be performed as young as 35 years. بالنسبة للإندوميتريوزس individual with endometriosis currently there is no national guidance on offering risk reduction surgery to women with endometriosis. لكن عندنا evidence من دراسات عديدة that endometriosis associated ovarian cancer may benefit from certain surgical and medical methods. والتوج ارتكل بيديني كل الموضوعات اللي اتعملت عليها دراسات هل بتأثر على التايب ده من الاوفيريان كانسر ولا لا، ونشوف الايفيدنس بتقول لنا ايه من كل واحد فيهم. Tubal ligation, which is often performed during endometriosis surgeries in women who have completed their families, tubal ligation is proven to reduce the risk of epithelial ovarian cancer, especially clear cell carcinoma and endometrioid carcinoma. Bilateral salpingo or oophorectomy reduce the risk significantly in women with endometriosis. However, it carries the risk of premature menopause and its associated morbidities. Excision of deep endometriosis. Radical removal of endometriotic tissue significantly decrease the risk of endometriosis-associated ovarian cancer. بالنسبة للميديكال therapies, combined hormonal contraceptives. It reduces the risk of endometriosis-associated ovarian cancer. وعندنا endometrioid carcinoma 21% reduction, clear cell carcinoma 27% reduction. And the prolonged use of oral contraceptive أكتر من 10 سنين appears to be protective. طب بالنسبة للبروجسترون only methods, there is limited evidence but some studies suggest a protective effect. Other medical therapies include aspirin. In general, aspirin decreases the risk of epithelial ovarian cancer in general population. Risk reduction بيبقى 0.87. However, no benefit has been observed specifically in women with endometriosis. Regarding GnRH analogues, further studies are needed to confirm their role in reducing endometriosis-associated ovarian cancer. المهم واحنا بنختار method for risk reduction ان احنا نعمل risk stratification. Factors associated with increased risk of ovarian cancer في حالات الendometriosis includes age more than 45 years, postmenopausal status, and large endometriomas more than 9 cm, and the presence of solid components. Regarding treatment, the treatment is the same سواء كانت endometriosis associated ovarian cancer أو non-endometriosis associated ovarian cancer. وأهم حاجة في التريتمنت هو surgical management. Debulking surgery. The primary treatment of ovarian cancer involves optimal cytoreductive surgery. The aim is to remove all visible cancers, ideally leaving residual disease less than 1 centimeter. This is followed by chemotherapy. والchemotherapy احنا عارفين ان هو بيبقى platinum based chemotherapy and the standard regimen includes a combination of carboplatin and paclitaxel. لكن هنا في حاجة مهمة هنقولها عن لأن احنا بنتكلم على endometriosis associated ovarian cancer إن حالات clear cell carcinoma may show resistance to platinum based chemotherapy. والحالات دي بتستفيد من novel adjuvant strategies. يعني هو ده هيبقى مدخلنا للنوفل adjuvant strategies. زي ايه النوفل adjuvant؟ poly ADP ribose polymerase اللي هو PARP inhibitors. This is used in endometriosis associated ovarian cancer patient with BRCA1 or BRCA2 mutations. And it is associated with improvement in progression-free survival and overall survival. And the NICE guideline recommends the use of PARP inhibitors as a maintenance therapy with advanced ovarian cancer, even in conditions without BRCA mutations. And then another option is checkpoint inhibitors. These are novel therapies targeting pathway like ARIDA1 and chromatin remodeling complexes. وفي drug جديد tazimtostat is an enhancer of ZEST homolog 2. However, this drug is still under clinical trial. And then another drug, gidatolizumab, has shown efficacy in combination with carboplatin and paclitaxel in early phase trials. However, further research is still ongoing. Regarding hormonal therapy, in selected cases of low-grade endometriosis-associated ovarian cancer, hormonal therapy may play a role. And this treatment focuses on estrogen suppression to slow tumor growth. However, evidence for this approach is limited and requiring further validation. بعد ما خلصنا التريتمنت نتكلم على الفولو اب. follow up بيبقى regular follow up every 3 to 6 months for 2 years وبعد كده every year. It includes the serial CE125 and imaging studies, and it mainly depends on clinical assessment. آخر حاجة بنتكلم عنها هي prognosis. In general, women with endometriosis associated ovarian cancer have improved the survival rates compared to women without endometriosis. This is mainly due to earlier stage of disease presentation and lower recurrence rates. ولو اتكلمنا على statistics والأرقام هنلاقي إن ال 5 year overall survival في حالات الاندوميتريوزس associated بيبقى 80%، في حالات non endometriosis associated بيبقى 70%. لو اتكلمنا على 5 year disease free survival في حالات الاندوميتريوزس associated بيبقى 77%، non endometriosis associated بيبقى 65%.